is the first time I'm trying to talk about my pregnancy. So right now I am 18 weeks pregnant, and I actually didn't plan to kind of like openly share my pregnancy, but John, my husband, he made a very good point. He said, you know, if we document more, then it might be interesting for little Emma to see in the future. Yes, her name is Emma, and I'm pretty excited that we're having a girl. Well, I know I'm very excited, and John, not so much. He's hoping for a little boy, but I'm very excited. 18 weeks so far, but I really haven't had a lot of symptoms up till this point. So I would say my pregnancy has been very, very smooth and easy. So thank you so much, little Emma, for making it so easy for me. And then the other thing I wanted to share is I have Graves' disease, which is a hyperactive thyroid disease. And at first, when we found out about it, we're kind of nervous because we didn't know what it was going to mean for this pregnancy and what it would mean for little Emma. And funny story is I found out about this pregnancy when I was getting tested for the thyroid disease. And what happened was, it was a very stressful time at work, and I was losing a lot of hair, and I was breaking out like crazy on my back. And when I went to the dentist, she told me that she's seeing recession in my teeth and that I needed to get my calcium level checked. So it was just like a weird time when I saw these weird things are happening to my body. So I decided to get a blood test just to make sure that, you know, I was healthy before kind of considering having a baby. So as I was, you know, getting my body checked out, and then so at first I went to see the on-site health care center at work. That's where they found out my thyroid level is not normal, and then they sent me to see a specialist, which is the endocrinologist. Then they found out, yes, my thyroid level is a little too high. And then right when and then she diagnosed me with Graves' disease. And then when she was kind of trying to decide what kind of medication to give me, I told her that my cycle has been delayed. And then she said, well, usually thyroid disease would kind of affect the cycle too, because the body knows it's not a good time to reproduce. But then she tested me for pregnancy anyway, and that was when I found out I was pregnant. So as a result, she couldn't give me any medication to treat my thyroid because it was going to affect little Emma. So of course she just said, well, let's just keep an eye on the thyroid level and then see. And then at first I was, you know, very nervous about it because I didn't want to just like do nothing. But then she said usually with overactive thyroid, typically it improves during pregnancy because the body detects that there is a foreign object in the body, and it would kind of prevent the body from producing that much hormones. I think that's how she described it. So I would say that in my first trimester, when I went back for more blood tests, yes, the thyroid level was higher than usual, but then I just kept on it was every 6 weeks. I would do a follow-up, and then in the most recent blood test, which happened a couple weeks ago during the second trimester, my doctor said my thyroid level has returned to normal, which is good news, and which is what she expected to see during pregnancy. So my next blood test would just be, instead of 6 weeks, it would be 7 weeks. And then I wouldn't need to go see her again in the office unless it turns out abnormal. And then she's thinking that she doesn't need to see me until 2 months after the pregnancy, because she is expecting the thyroid level to return. So that's a little bit of a backstory as to how I found out I was pregnant and what it means to be diagnosed with Graves' disease while being pregnant. And I would say, other than the thyroid disease, my pregnancy has been super easy and super smooth. And right now this is actually where I wait for my shuttle to go to work every single morning. So I'm going to try to do more of these updates, hopefully on a weekly basis, and hopefully in the future when Emma grows up, she'll have something to refer to and she'll find these vlogs interesting. Okay. Some of the earlier ultrasound images. This was Emma when she was 9 weeks old and only 2 centimeters long. At this time, she was the size of a cherry, and you can already see her head. And in the ultrasound, we saw that she was already waving her little hands and legs at the time. Well, of course, we didn't know that she was a she back then. So that was very interesting to see. I didn't expect that at 9 weeks you can already see like a human form. I was expecting to see like a little meatball. And then our second ultrasound was taken when she was, how many weeks? Oh, 13 weeks old. And this image is super clear. You can see her vertebrae. And then, oh, this was when they measured the thickness of her neck? No. The space between her neck bone and the back of her head, I guess, for Down syndrome risk. And that turned out to be pretty good. And this is her little arm and her legs and her shape. So when we took the ultrasound, I actually thought she looked like a boy. And then I was thinking, man, I really wanted a girl though. And at this time, at 13 weeks, we didn't know if Emma was an Emma. But I was really hoping Emma was Emma.
You've arrived at your destination.
I found expectant mothers parking. Yay! Hello, I just got to work. I didn't take the shuttle today, and I drove instead because I had a early morning meeting. And I'm very happy to have found expectant mothers parking. It's the first time that I'm parking here, and I feel a little bit bad because I'm not super big yet, but parking lot is full, and so I parked here. Tomorrow, we are going on our baby moon. Super excited. I'm just a little bit worried about our cats. I hope they survive. My friend Roger will come and check in on them every 2 to 3 days just to make sure they're okay. We've only left them at home alone overnight once, but this time we're gonna be gone for about 10 days, so hopefully everything is okay. Yeah. Just got off work. It's been a really long day. It's now 7 p.m. and I've been listening to this radio station for classical music. My hope is that little Emma gets used to classical music, so when she's born, hopefully I could play it to her, and then hopefully it will be able to calm her down. This is my bump at 18 weeks. It's a little bit round. Not too round. We've been measuring my belly every week, and right now it's about 31 inches, and I've gained about 3 to 4 pounds so far. At first I was thinking maybe I'm not eating enough because my appetite hasn't been too good, so then I asked the doctor if Emma is at an okay size, and then she said yeah, everything looks normal, so I'm happy that everything is progressing just fine. I just kind of want to make sure that, you know, she's growing at a normal pace and not like undersized.